I want to get into some of these host factors, specifically, really starting with sex and biological variables like that. What was some of the most compelling data presented today on sex-based differences in immune responses to checkpoint inhibitors or cellular therapies?
Yeah, so I had the pleasure to actually lead that presentation, and it was very informative. I think, at least for me, that I had to go back and study this topic. So it's very interesting because in general, um, um, males tend to have more cancer than female. But if you look young adults, actually females have more cancers than males. And if you look at the death rates, actually males die more for cancer than female. So already, like in terms of cancer incidence and cancer outcomes, there are differences. Now, when you're thinking about chemotherapy or targeted therapies, typically females do better. They might have also more adverse events, but in general, they do better. It's interesting that potentially with checkpoint inhibitors, there is a trend that male patient might be doing better. Um, Other more recent studies suggest that maybe this difference doesn't hold and might be related to other factors. Like, for example, we talk about obesity and so on. But there might be that with checkpoints, this balance on female doing better is not completely true. We then look at CAR T cell therapy, bispecific therapy, and there is always a trend where female patients do slightly better. And so I think this is fascinating because it really tells you that there are factors in females that lead to a immune system that is more activated. And so it's able to clear the tumor better. Obviously, we don't know much about the mechanism. I mean, there are some studies. Obviously, hormones are involved. Of course, women have estrogen, men have testosterone, and they play a different role in the immune system. But there are also genes that are related to the immune system that, for example, are expressed in the X chromosome. You know that women have two, males have one. Um, and then there are lifestyle factors. Men tend to be drinking more, to be smoking more, to do to potentially be more obese. So all these factors do play a role and do affect.
Mhm. And what aspects of the tumor immune microenvironment seem most influential by patient sex, or how might that translate into different differential efficacy or toxicity?
It's a very fascinating topic. So if you take biopsies from male and female patients, right, and you compare them, it's so interesting that female patients tend to have a what we call hot microenvironment as compared to the cold microenvironment in male. When we say hot tumor microenvironment, we mean that there is a lot of infiltration of immune cells as compared to a cold microenvironment in males where it's sort of there are less immune cells. Now, having more immune cells, T cells, B cells, myeloid cells, is typically associated with a better anti-tumor response. And so clearly that tells us that the makeup that we have with hormones and genes in female leads to a enhanced activation of the immune system. It's not surprising that women have more autoimmune disease as compared to men, and so there are nice sort of like we can like from different aspect of human health we can sort of notice these big differences.